Now we start with the next. To assess the visual outcomes in 4 different types of extended depth of focus intraocular lenses. The chief and presenting author will be Dr. Deshpande.
Thank you so much. So conventional multifocal IOLs have give a specific foci, and only the sharp vision is around the limited zone around the foci, and also there are issues of dysphotopsia and loss of contrast. In contrast, EDOF technologies give an elongated focal point with an enhanced depth of focus, and this aims to reduce photopic phenomenon, glare and halos. So we have compared 4 different EDOF lenses: LuxSmart, Alcon VVT, Rayner EMV, and Acryl ICERT. And the outcome measures were uncorrected distance and visual acuity, intermediate and near visual acuity, post-operative contrast, and patient satisfaction in all these groups. So we use type 5 EDOF IOLs, which are the lenses characterized by variation in the geometry of their central optical area. So methods were data from cataract patients was collected between January 21 and August 23. Age range was 40 to 90 with both genders, and we excluded corneal abnormalities, retinal abnormalities, prior surgeries, severe dry eye, and pre-operative, the expected visual outcome of 6/9 or worse. So demographics, again, and gender and female ratio was well balanced. We included with patients undergoing only phaco or those with flax and others like those who were combined with other glaucoma surgeries. Most of the patients, 5.4% patients had glaucoma, and 3.2% patients had some form of diabetic retinopathy, including 1 or 2 patients of cystoid macular edema. Then spherical equivalent, you can see 1 month and 3 months. There was an excellent outcome in all 4 groups of intraocular lenses. Only cylindrical IOLs were present in Alcon, were available in Alcon VVT and Rayner EMV. That is why baseline you see higher cylinders in these 2 groups. But if you see 1 month and 3 months, there was excellent outcome even in patients who had preoperative cylindrical power. Refractive add, you can see average add given was around 1.5, but Acryl ICERT had a higher add in this group, and which continued into 3 months. Some of the patients who came back on 3rd month, although the number of patients who came on the 3rd month were little less, some of them demanded higher near add, and so it was corrected and given a higher add at the end of 3 months. Uncorrected distance visual acuity was excellent in all 4 groups. Uncorrected intermediate visual acuity was best in LuxSmart and Alcon VVT compared to Rayner EMV and Acryl ICERT, with almost 90% patients having excellent intermediate visual acuity in LuxSmart and Alcon VVT group. Uncorrected intermediate visual acuity at 3 months was again excellent. Near visual acuity was 60% in LuxSmart and 70%, which were both better than Rayner and Acryl. And again at 3 months it reflected similar trend. However, again our number of patients at 3rd month were little laser, and some of them demanded higher ads, so that is why there is a change in the little bar height in at 1 month and 3 months. The defocus curves were like this for VVT, Rayner, and Acryl ICERT. LuxSmart and VVT gave excellent defocus curves with almost 1.5 diopter of depth of focus. Contrast was excellent in all 4 groups. Patient satisfaction again was pretty good in all 4 groups, but best in LuxSmart, Acryl, Rayner, and Acryl ICERT. So all groups did quite well. So there were no severe subjective disturbing symptoms in any of the groups, and overall satisfaction, most of the patients answered to be very high or high according to the Presque questionnaire that we used. Thank you.
That was a very nice study.
So did you use all the 4 IOLs you did comparative analysis?
Yes.
They all are refractive base?
Yeah, they are at type 5 of lenses.
No, VVT is refractive base, that I know.
They all have altered surface of the lens, and there are...
what I am saying, are they diffractive base or refractive base? VVT is refractive.
Refractive, of course.
No, all LuxSmart and all lenses are not refractive base. That's what I'm asking. You compared 4 lenses.
agree. See, if you Rainer EMV says they are doing aberration correction, but when you see the classification of lenses, now Minivel is type 1, which is pure aberration based lens. So when you see the category of of the EDOFs in which they fall, all of them fall in type 5, where there is some alteration on the lens surface done in the central zone in a different way. Like maybe they are not exactly same optical principle.
I think acrylsat is diffractive.
Yeah, but again, that's what.
You know?
But it falls when the categorization of lenses is done. It falls in type 5. So I agree with you. There are diffractive elements, but when there was a classification, it's published, so that they have categorized in type 5. So all of these lenses.
Where is this classification?
Uh, there is a meta-analysis done, and I have taken it through that. I can't really exactly remember the. So there is a meta-analysis published, and where they have categorized these lenses.
Right. Thank you.